Okay, hi David, it's Dr. Buford. We're just getting started on the right knee. We've already harvested or obtained 120 cc's of bone marrow from your posterior iliac crest. And with that, we're going to make about 16 cc's of bone marrow concentrate. About 10 cc's is going to go into that lateral tibial bone marrow lesion just underneath the joint line. And the rest of it we're going to do intra-articular. Now this medial compartment looks great. The meniscus here looks good. The femoral condyle up above looks good. The meniscus, as I look towards the posterior horn back there, looks pretty good too. I don't see any signs of any tearing. We can probe that in a minute just to make sure, but that sure looks great. All the way up to the anterior horn. Okay, so now we're looking in the central part of your knee. That ligament you see right in the front there, I'm going to touch you with a shaver. That's your anterior cruciate ligament. That looks great. Behind this little fat pad here is the posterior cruciate ligament as it inserts into the medial femur there. I don't see any problems here. Cartilage here looks good. We're going to get a better look at the patellofemoral joint in just a minute. And so now we're going to spend a little time and look over here in the lateral compartment. This is where that bone marrow lesion is, and we can start to see why. We're going to look at the patella first. We'll show you some more in just a minute. Hold that. Okay, so now we're looking at the patella up above. Patella looks good. What doesn't look so hot is this trochlear area here. Do you have a ruler or something we can measure? I guess I can use the shaver, but if you have something else. And we're getting a good look at this defect that we've already seen on the imaging, of course, but now we're getting a good look at it under the magnification of the arthroscope. We can use, here's our shaver. Put my pressure up to 60 there. Okay, so we're using the shaver just to make sure there's no loose edges here. And you can definitely see down here this cartilage is a little bit loose. And like we talked about, we may have to do a cartilage procedure for you. But we're trying to see if we can get by without right now. So okay, so I like that. We're going to go ahead and look in the lateral compartment next. Let's take this down. Okay, so we're in the lateral compartment now. And we're just flushing a bunch of salt water through. So we can see you've got some chondral or cartilage loss in this lateral femoral condyle also. You see this area here? So this gives us now a pretty complete picture of why you're having symptoms in the places that you are, and why that tibia has this bone marrow lesion and signs of ongoing stress, because you're missing a lot of cartilage here on the femur as well. Okay, so I think we've done a pretty good job making sure the edges are somewhat stable. We'll show you some more in a little bit. Let's switch it back. Just want to give you an idea of the measurement on this lateral femoral condyle. That's the 1 centimeter mark on the shaver. So we're more than a centimeter, probably closer to 2 in the anterior posterior dimension and at least a centimeter medial lateral as well. So 2 big lesions, and now we're going to make some plans to use some of our regenerative medicine tricks. Okay. One of the things we've decided to do is to place some of our bone marrow concentrate right into this area. If we ever decide to do a Macy procedure or some other procedure, then this is basically like seeding the field, because they're going to place some healthier bone marrow and some concentrated bone marrow right here in this location. And so as you see, this is just an 18 gauge needle that we can very easily place into the bone. And once we have it deep enough, hold the camera there, we're going to take some of our bone marrow concentrate. I've got the pressure turned down low. We're on about 30 on the arthroscopy pump, just so we can see. Let me get a third pair of gloves. Oh, so you need to change because that's not... Okay, yeah, you stay just like that. Can you get us another pair? Pause. Yeah, please. Okay, so we're recording, and there's nothing coming out of the spinal needle, so I know that we're in a good spot. And we're going to slowly inject, and I'll read off the volumes. That's just about a cc and a half. Okay. You can see it's starting to come. I'm going very slowly so that we get some spread. Okay, we're up to 3. And now 4. And there's our 5 cc's. So we got 5 cc's in. Nothing's leaking out. And that looks good. Pause. No. Okay, so this is your tibial side, your femoral side on the lateral side of the knee. So that's the femoral condyle. That's the lateral meniscus, and you can see we've got a good angle. Hold the camera there. And we're going to now slowly inject some bone marrow concentrate there. And again, I'm taking my time. I want this to not extravasate right away anyway. Okay, pause.